us now is Professor Bello Mohammed, who is a clinical and radiation oncologist and chief consultant at the National Hospital right here in Abuja. Thank you so much for joining us. Good to see you on a day like this. Well, I mean, you couldn't overemphasize the importance of awareness when it comes to cancer. But let's even talk about the fundamental issue. To what extent would you say that cancer is a lifestyle disease as opposed to maybe genetical, a genetic disease, and all of that? Let's start from that premise.
So thank you for having me. Well, basically, we have realized that there is a increase in the incidence of cancer around the globe, including Africa and Nigeria in particular. And three fundamental things, really, which revolve around the lifestyle are the real culprits. Number one is more intake of alcohol, more intake of tobacco, and then obesity. So these three things are the main real culprits why we have a high prevalence, high incidence of cancers now around the globe. So if you look at tobacco increase, it's happening mostly in low and middle income countries where, there are less laws allowing the companies to come and thrive in the name of investments, and so also the alcohol industries. And then, of course, we have developed this sedentary life. We no longer do a lot of joggings. We have a lot of cars. We, in the name of urbanization and civilization, we enter cars, we enter planes. We don't ride bikes. We don't trek. We don't do horse riding. So because of that, we feel we have reached that level, of civilization. And because of that, and it also comes with a lot of new diet that we have. We have high intake of red meat, like before, where you eat, lean meats, and then, of course, you eat a lot of milk and some fulani. So, milk used to be, the staple food and all that. I hardly see milk now, except if I want to take a cup of tea or something. So, yes, lifestyle really is something that we really need to look at.
I want to stay on lifestyle use. I just wished I could chuckle and smile while you are talking, but it's something serious, it's grave. When you spoke about lifestyle, I started thinking about the young people that are also being diagnosed. Yeah. Once upon a time, you hear stories of older people, and the worst could be maybe breast cancer, but today I heard you pluralize it, cancers. We have different kinds of cancers. Now, let's speak more on the age ranges that we are dealing with at the moment. How do you also explain some of the very young people who are coming down with cancer?
Right. So they have always existed cancers of the childhood. So cancer, they said it's a democratic disease because it affects everybody. A child yet unborn can come out with cancer. An infant can have cancer, adolescents and so on and so forth. So yes, we have cancer of the childhood, we have cancer of the adolescents, and then we have cancer of the adults. But even at that, we have begun to realize that some cancers that used to be in the 40s, take for instance prostate cancer, which is usually found after the age of 40, and that is why, in fact, in Caucasians and other races, screening with PSA tend to start at the age of 50. But we see patients that come with very bad diseases after the age of just 40. So we have to look at the guidelines going forward to see that we need to start screening a little bit earlier. Of course, we know that prostate is much more prevalent in the black race for so many reasons. And then even looking at breast cancer, for example, a lot of young women, we have diagnosed a 17-year-old with a very bad breast cancer. It was even shown today at the symposium, an image of that patient. So a lot of the patients are presenting a little bit early, maybe a centile as compared to those that used to present in our environment.
Now, let's talk about calls for governments at all levels, federal, state, to improve access to, cancer care across the board. That seems to be where the challenge is, closing the
Care gap.
The care
Yes.
gap. Where do we start from, especially at the governmental level?
So it's really dicey. I mean, it's very important that government must realize that cancer is an epidemic disease now. It has taken epidemic proportion because, and that's why this World Cancer Day is set aside. And the subtheme for this year is to talk to government, the people that are really at the policy level, to show them the importance of cancer care, to make them realize that there is inequality in cancer care across the globe, and they cannot sit on the fence. You see, when you look at the statistics of how many patients were recorded in Nigeria, 124,000, that is not even the news. The news is out of that 124, how many have actually died? Over 79% of those people that were diagnosed have actually died.
Oh my.
And that is because there are no infrastructures, there are no capacity, and so many things around cancer care. And these, in most instances, are provided by government and indeed by private sector. But the private sector need a lot of encouragement from government to be able to really function, because cancer care around the globe is very expensive and just ordinary people can't do it.
And listening to you, this is very grave. How is it that till this moment we still haven't seen this collective effort, the way we pursued COVID, since it can affect anyone and everyone?
Well, the truth of the matter is this is not something that will hit you and you die instantly, like Ebola, like COVID. It's not that kind of infectious disease, though some of them are as a result of infection. These are diseases that take time to develop. Every cancer takes about 5 to 10 years in most instances for them to develop, especially those that have, causative agents like, the human papilloma virus that causes the cervical cancer and other cancers. When you get infected, it takes a long time.
In other cases, in other words, it gives us time to prepare.
So, well, that should have been the right thing to do, but it seems to me that a lot of things we've not been prepared about.
Right.
And
very
people
quickly
that can afford care are not in this country. That is where the problem is.
Yeah.
People just fly all around. That's why medical tourism is thriving in India, in many parts of the world. There is no country that you will go and you will not see Nigerian patients. And 95% of them are cancer patients. And we are not doing anything about it. And it's so expensive, and it is a capital flight.
Let's talk about prevention. Let's even underscore that. And I'd like you to very quickly, if you can, address the issue of misdiagnosis. We had a young lady here last week that we featured here. Unfortunately, she was misdiagnosed for cancer. She was given, chemotherapy and all of that. How do you ensure that you don't find yourself in that kind of situation?
So it's all part of the whole issue of providing capacity for continuum of cancer care. The cancer care starts from the time someone is given a proper diagnosis up to the time that the person actually dies. In other words, it gets to a point where probably if it's not cured, the disease progresses and so on. So that we must provide comprehensive cancer institutions in this country, where a referral center, where we can validate a lot of the tests that we have done. Because most of the people that are doing most of the investigation, the treatments, are not properly trained, and they have no option. If you look at, say, for instance, how many pathologists do we have in the country that will be able to man the teeming population of patients. They are really, really negligible. Oncologists, for example, like me, this country need about 3,000 to 4,000 oncologists.
And you have how
We
many
have
now?
less than 100. We have less than 100, and out of that less than 100, maybe about 30% have left the shores of this country.
Really?
So you can imagine how bad.
It's bad. Let's just say 30 seconds. What do we need to do very quickly? Ordinary, people like us. 30 seconds. What do we need to do at least to reduce
Well,
our
create
exposure?
awareness, go and prevent those that you can prevent, that is by going for vaccination, by screening, and creating awareness and talking to your doctors. It's very critical you do that.
Well, it's a fine place for us to leave it. We do hope that you find time to come again. Professor Bello Mohammed, clinical and radiation oncologist and chief consultant at the National Hospital here in Abuja. Thank you for your time.